All right, so here are some videos of people who have been through treatment at TDC with Dr. Beck, which means, well, I'll show you some more of these later, but there's some incredible success stories. But let me go through those later. Let me start reading this article first. So best treatment for stroke recovery is TDCS. So when it comes to finding the best treatment for stroke recovery, many people feel overwhelmed by the limited options offered by traditional medicine. Now, fortunately, emerging technologies like TDCS, Transcranial Direct Current Stimulation, are transforming the landscape of brain health and offering new hope for stroke survivors. Okay, so what is the game-changing technology? TDCS. TDCS is a non-invasive, painless therapy that uses low electrical current to stimulate specific areas of the brain. So by enhancing the brain's neural ability to form new connections, TDCS helps restore normal function in damaged areas. This groundbreaking approach to brain rewiring has shown remarkable results for individuals recovering from neurological injuries like stroke. The true power of TDCS lies in its ability to target the brain with precision. Unlike medical and other therapies that have widespread effects, TDCS focuses only on the area that you need stimulation, promoting optimal recovery without disrupting other brain regions. So the thing is this, when you've had a stroke, there's specific areas, right? And that's why the body, that affects the body differently. So for everyone, some could be speech, could be vision, could be memory, can be a lot of different areas. So you want to target that specific area. You do medication, it floods the entire brain with medication. It's very, very different. So that's why you want to specifically go after that area or that area, wherever that issue was. Proven results, TDCS in the military. The effectiveness of TDCS isn't just theoretical, it's been rigorously tested in high-stake environments. The military has long used TDCS to enhance the cognitive abilities of snipers and drone operators, where split-second decisions, laser-sharp focus can mean the difference between success and failure. By improving mental clarity, decision-making, and focus, TDCS has proven itself as a tool for optimizing brain function. The same precision and effectiveness are now being applied to healthcare, where TDCS is giving stroke survivors a chance to regain lost abilities to rebuild their lives. I'm telling you, it's amazing the stuff that people are experiencing with this treatment. Dr. Randy Beck's home-based treatment and innovative approach. Dr. Randy Beck, a leader in brain health, has elevated TDC therapy by combining it with decades of expertise in brain rewiring techniques. There are other ways of doing it, but it's not as effective. It just takes a longer time. But he's combining those old school techniques with TDCS. So his approach is uniquely tailored to address even the most challenging and unusual symptoms, conditions that traditional medicine often deemed untreatable. Dr. Beck's home-based treatment protocol, which is amazing, which is what I do now, integrates TDCS with advanced diagnostic tools like QEEG scans, which helps the brain map activity pinpoint areas of dysfunction. So you do a brain scan, and they can see exactly where the areas that are having issues, that are not communicating, or have been damaged. By leveraging these insights, he crafts customized treatment plans that target specific brain regions, helping patients achieve lasting memory. Let's take a look at this video. This is stories of people that have gone through incredible recoveries. All right, so let's start with this video. This is from IFN, where I was treated as well. And this girl right here, she was 16 years old, and she had a traumatic brain injury from a car crash. And you can see the eyes are kind of not able to focus all over the place. And check this out. She was told there's nothing that could help her, okay? Very, very serious. And you can see the eyes are not able to go straight. So after 6 weeks at IFN, with the treatment plan, very intensive plan, she resumed back to normal life, okay? Isn't that amazing? That big smile. Okay, so this is Madison at age 4. She was treated for severe epilepsy at IFN. She could have up to 100 seizures per day. This is her first QEEG with IFN. You can see they put the cap on. And within literally within a week, 90%, the seizure rate dropped by 90%, which is incredible. All right, so this is a guy named RH, 12 years old, had a bicycle accident and had worse and worse, that deteriorated, leg pain, unable to walk, all these different things. And you see him, and his parents are being told that he's simply trying to get attention, you know? And it's just so sad, you know? So anyways, they started working on rewiring his brain. 6 months, now he's able to walk. 9 months of care, now he's jogging. And now he's back to living a normal teenage life, you know? It's just really, really incredible. So this is the story of Sam at 18. He was quadriplegic from a severe injury to the neck, which left him quadriplegic. Very, very serious. Less than 1% chance of ever having any movement in his feet. After 6 weeks of treatment, look at that. He's moving his leg. Isn't that amazing? After 12 months, he's able to walk aided, but then now this is still after 12 months. And as you can see, now dancing his way to recovery, That's incredible for having a 1% chance. And using rewiring the brain, but also electricity up and down the spine. So finally, against all odds, Sam walks unaided. This is amazing. Okay, so this is the story of Ben, considered a problem child at school. He was diagnosed with ADHD, dyslexia, and had a lot of issues. Was just failing at school and unable to achieve the milestones. IFN identified that he had sensory confusion, which was involved his eyes, not ADHD. Okay, very, very important. So after 12 weeks of treatment with IFN, he no longer suffered with anxiety. He's back to living a normal life, and he's winning like awards at school. So anyways, I'm telling you, these stories it's remarkable. These are the toughest cases that are out there. They all go to Dr. Beck, because if he's the only one that's able to get that brain functioning the way it's supposed to, and because of the techniques that he's done and experience. So when it comes to looking at a brain scan, QEEG, he's the best in the world to be able to determine, okay, what treatment plan do I need to tweak it to get it back to functioning again. All right, so look, so this is Dr. Randy Beck. I do receive a referral commission if you use my promo code Bjorn. Home care is available for international patients via video call. By using my referral code Bjorn, you'll not only receive a discount on your first treatment, but you'll also be supporting my mission to reach more people who are in a similar situation to mine. So look back, the history of TDCS, while TDCS may seem like cutting-edge technology, its roots dates back to the 19th century. Okay, this is not shock therapy, right? When Italian scientists, well, maybe that's what they did then, but now TDCS is not shock therapy. First explored the effects of electrical stimulation on the brain. Over the decades, researchers refined this technique, transforming it from experimental therapy into a proven treatment. In the 21st century, advancements in neuroscience and technology have propelled TDCS to the forefront of brain health. Its applications now range from enhancing performance in elite professionals to providing life-changing treatments for individuals recovering from stroke or other neurological conditions. So here you see a picture of QEEG scans. It's the foundation for precision. QEEG scans is an advanced brain mapping tool that plays a vital role in TDCS treatment. These scans provide a detailed picture of brain activity, highlighting areas of overactivity and underactivity. By comparing a patient's QEEG results to patterns found in healthy brains, clinicians like Dr. Beck can create a precise roadmap for treatment. This targeted approach ensures that TDCS stimulation is applied exactly where it's needed, maximizing its effectiveness while minimizing potential side effects. So this is what it looks like. See different colors. Colors mean different things. Some areas of the brain are going too fast, some going too slow, some are not talking together, some is too much noise, everyone is screaming at each other. It's a mess. And that's what we got to sort it out. While Dr. Randy Beck's approach is effective, when seeking the best treatment for stroke, many options focus on symptoms management rather than addressing the root cause. Dr. Randy Beck's approach stands apart because it combines time-tested techniques for brain rewiring with cutting-edge technology like Transcranial Direct Current Stimulation and QEEG. This unique combination allows for precise and lasting brain recovery, a unique blend of expertise and innovation. Dr. Beck's methodology leverages decades of research in brain rewiring, incorporating both traditional and modern techniques. For instance, one classical method involves using a mirror to create an illusion of movement in a paralyzed limb. By tricking the brain into thinking the non-functioning arm is active, this technique rewires neural pathways to restore movement. By integrating these tried and true strategies with advanced technologies like QEEG and TDCS, Dr. Beck has developed a holistic approach that targets the brain's exact needs. QEEG scans provide a detailed brain map of brain activity, identifying overactive and underactive regions. This information enables highly personalized treatment plans that stimulate the specific areas of the brain without affecting healthy regions. Very, very important, okay? You flood the brain with medication and it affects the whole brain, and it can have a negative impact on the different areas that are healthy, that are fine. So you want to go and get only the areas that need the treatment. So precision that sets TDCS apart. Unlike many therapies that treat broad areas of the brain, TDCS offers unmatched precision. Stroke often leaves some brain regions overactive while others are underactive, disrupting the balance necessary for proper function. TDCS targets these imbalances by stimulating only the areas that need an intervention. This level of precision avoids the common pitfall of overstimulating healthy brain regions, while it can create new problems. Instead, TDCS works to restore harmony within the brain, gradually improving its overall functionality. For stroke survivors, this means a greater chance of regaining lost abilities and reducing long-term symptoms. Here you can see what it looks like. You put the anode and the cathode, like the direction of the flow. You can put them on different sides, depending on. Dr. Beck is the one that knows how to do it. He's one of the few in the world who can do this at this level. That it combines it with the different techniques from just decades of learning that have been used for decades, but now combining it with TDCS, you give it a little bit of nudge to get the brain to go and do what it's supposed to do. Neurofeedback doesn't give that nudge just by watching a movie. Like, a lot of people have success with that as well, but having a little bit of that electricity going through pushes it to make it happen faster. Even though the changes he makes is very, very slow. All right, Dr. Randy Beck, the expert behind the results. Dr. Beck, expertise in interpreting QEEG scans is a key factor in his success. With decades of experience and a reputation for treating most challenging cases, he's widely regarded as one of the forefront authorities in brain health. His ability to analyze brain activity and customize treatments has made him a sought-after expert for severe and complex conditions. What truly sets Dr. Beck apart is his focus on treating the brain rather than just managing symptoms. By using QEEG data to compare a patient's brain activity that of healthy individuals, so they compare your scan with healthy individuals who don't have those symptoms, he identifies the specific imbalances that need correction. Over time, his approach restores the brain to a state of normal functionality, often eliminating symptoms entirely. The philosophy, okay? Treating the brain, not the symptoms. Stroke recovery isn't just about improving physical abilities, it's about addressing the brain's underlying issues. Dr. Beck's approach recognizes that the brain is the control center for every aspect of our lives. Rather than treating the surface level symptoms, he works to rewire the brain so that it can function as it's designed and meant to do. This gradual process ensures that changes are sustainable. By tweaking brain activity sessions by sessions, the treatment allows the brain to adapt and heal without being overwhelmed. Over time, patients often find that their symptoms diminish or disappear altogether, replaced by a newfound sense of balance and normalcy. Why this approach is a game changer for stroke recovery. For those searching for best treatment for stroke, Dr. Randy's method represents a groundbreaking shift in how we approach recovery. By combining old and new techniques, focusing on precision and relying on extensive expertise, this approach offers hope to individuals who may have been told their condition was untreatable. That's how I was. I didn't have stroke, but what I had was very severe. It was one of the worst cases, and everyone told me I was no hope for me. With TDCS QEEG at its core, this innovative therapy is helping stroke survivors achieve outcomes that once seemed impossible. It's not just about improving quality of life, it's about restoring the brain's to its full potential. At my website, you can see, go in the description, you see the link, stories of hope and transformation, remarkable success stories from IFN, tons of different stories. Here's the case on autism, and so just be encouraged. Here's my story. You can see how I spent $250,000 traveling the world trying to get well, and I finally found Dr. Beck, and he's got me well. So I'm very biased because this treatment is the only one that works. You can do it at home without having to spend so much money traveling to other places. And you saw these videos. Go check out the video. It's fantastic. So if you know somebody, loved one that has had stroke, they need to get a scan, see what's going on in the brain, have Dr. Beck look at it, and then decide if you want to move forward with the treatment. Use my promo code Bjorn. Of course, I get a commission for that. You're helping me out as well. So check that out. But just get a scan and see what he says, and then he can give his opinion on what he thinks is best for you to be able to do. So you can do it at home. You just do a video call. You put the little placements on. I mean, it's incredible. It takes 20 minutes. You do it 4 times a week, and you start seeing the results. So if you have any questions, let me know.